Hello, and congratulations on taking this important step towards your improved periodontal health. We know that preparing for surgery can feel overwhelming, but don't worry, we're here to help and guide you every step of the way. In this video, we'll go over the essential steps to prepare you for your upcoming procedure. We want to make sure you understand and know what to expect and how to follow the pre-surgical instructions for the best possible outcome. If at any point you have questions or concerns, we are just a call away at 850-692-9200 during our regular business hours. My name is Cody, and I'll be walking you through the process. Together, we'll review the contents of your pre-surgical packet. This packet contains everything you need to know from how to prepare for your surgery and includes important forms such as the pre-surgical instructions, Halcyon consent form, nitrous oxide consent form, as well as the post-operative instructions and a soft food suggestion list for after your procedure. To ensure that everything goes smoothly, here are the key instructions for preparing for your surgery. Please take all routine medications as directed by your physician. If you are on any prescribed anticoagulant medications, such as Plavix, Coumadin, Eliquis, or others, make sure to inform our office right away. It is very important that we are aware of any changes to your medications. If you have started, stopped, or changed a dosage recently, please notify us as soon as possible. This will help us ensure your safety during the procedure. Please discontinue Advil and any non-prescribed, non-steroidal anti-inflammatory medications 3 days prior to your appointment. Additionally, discontinue any vitamin E and fish oil supplements 3 days prior as well. These instructions are crucial because certain medications and supplements can increase bleeding during the surgery. If you have questions about which medications are safe to take, feel free to contact our office for clarification. Prescriptions will be prescribed to you and should be filled prior to your surgical appointment. To minimize patient discomfort, antibiotics and anti-inflammatories may be prescribed, so you can begin them the night of the procedure. On the day of your surgery, please wear warm, comfortable clothing. We recommend wearing a loose-fitting top with sleeves that can easily be rolled up, as we will need to take your blood pressure during the appointment. Avoid wearing jewelry, makeup, or artificial nails. Removing artificial nails and nail polish is important, as we will be monitoring oxygen saturation with a device that reads through the nail bed. This helps us maintain a sterile environment and makes it easier for our team to provide the care you need. After surgery, it is important to take it easy and give your body the best chance to heal. You'll find a detailed post-operative care form in your packet that covers everything you need to know about recovery, including how to manage discomfort and promote healing. If you have elected to use oral sedation, Halcyon, your seat in the car ride home should be in a reclined position. When at home, lie down with the head slightly elevated, and someone should stay with you for the next several hours because of possible disorientation and/or injury from falling. After your procedure, you may experience some discomfort, swelling, and minor bleeding. These are all normal parts of the healing process. It is important to keep your head elevated and rest for the remainder of the day. Avoid strenuous activities and try to relax as much as possible. Discomfort can occur, and the most discomfort you may experience may occur for a few hours after the sensation returns to your mouth and may gradually increase again for 2 to 3 days, with a gradual decrease and discomfort in the following days. Avoid excess sucking or spitting. Do not pull your lip or cheek to look at the surgical site. Some oozing and discoloration of the saliva is normal. If bleeding is severe or persists, moisten gauze or a tea bag. Wring out the excess water and place against the area where the bleeding is coming from. Hold it in place with moderate finger pressure for 20 minutes, repeating as necessary. Swelling can be managed with ice packs. Hold on the area for 10 minutes and then 10 minutes off for the first 24 to 48 hours. Avoid smoking during the healing period, at least 7 days. Purchase the patch if necessary. It is recommended that you do not smoke for the first 2 weeks, since smoking can interfere with healing and make the results less predictable. If a bone graft was placed, it is recommended to quit for at least 6 weeks. Smoking or vaping of any kind, including inhaled use of recreational marijuana, can lead to complications in surgery, and the intended result may not occur. You will be provided with a pain management plan, which may include prescription pain relievers or over-the-counter medications such as Tylenol or ibuprofen. Always take your medication with food, milk, fruit juice, or a glass of full water to avoid an upset stomach. A soft diet is recommended during the initial stages of healing. Foods like yogurt, applesauce, and scrambled eggs are ideal for the first few days after surgery. We also have a soft food suggestion list in your packet, which provides plenty of ideas for the meals that are easy on your healing gums. For the first 24 to 48 hours, one should rest. Patients who have sedation should also refrain from driving an automobile or engaging in any task that requires alertness for the next 24 hours. It is important to avoid peroxide, alcohol, carbonated beverages, drinking through a straw, and spitting for the next 2 full weeks. Begin rinsing with Paradex twice daily until instructed to discontinue. And if antibiotics are prescribed, be sure to take the full prescription as directed. It is not recommended to use Paradex more than twice per day, as there is no increase in effectiveness. You may begin brushing and flossing the untreated areas of the mouth on the day following the surgery, depending on the procedure. Avoid the surgical sites until given specific brushing instructions at your post-op appointment. Paradex, the prescribed mouthwash, can take the place of brushing and flossing during the healing phase. Do not use an electric toothbrush at the surgical site for the first 2 weeks. For swelling, use a cold compress like an ice pack. Hold on the area for 10 minutes and then 10 minutes off. If sutures are placed, they may dissolve or will be removed at your follow-up appointment. As a reminder, do not pull your lip or cheek to look at the surgical site, and try to avoid playing with the sutures with your tongue. If you are experiencing any of the following, give our office a call immediately and we will direct you from there. If bleeding is excessive and pain cannot be controlled, if you need a refill of medications, if you are experiencing excessive nausea, or if you are having an allergic reaction to a prescribed medication. Most patients experience peak of swelling 2 to 3 days after surgery. If swelling increases or spreads after this point, please contact our office for further instructions. Please refer to your pre-surgical instruction packet for a list of suggested food options during the postoperative period. For the first 24 hours, you will want to eat soft or cold foods, such as vanilla ice cream. Drinking nutrient-rich smoothies like Boost, Ensure, or similar options can help you maintain essential nutrition during this period. After 24 hours, you may add soft, warm, not yet hot foods. After 48 hours, you may add hearty, warm foods, and after 4 to 5 days, you may add in soft meals to your diet. If you are taking Halcion or using nitrous oxide, please take a moment to review the consent forms included in your packet. Feel free to ask your dental assistant any questions you may have while going through these consent forms. They will be happy to help you. These documents outline important information about potential side effects and guidelines as discussed in this video to ensure a safe experience. We're committed to providing you with excellent care, and we're here to help make this experience as smooth as possible. Your comfort and safety are our top priorities. Remember to arrange for your escort, fill prescriptions ahead of time, and make sure you understand all instructions thoroughly. If you have any questions, please do not hesitate to reach out. We are here to support you and want you to feel confident and prepared for your surgery. You can contact us during regular business hours at our phone number 850-692-9200. If you need emergency assistance after hours, our emergency number is listed below. This line is monitored periodically over the nights and weekends, and you should expect a response within 12 hours or less. Please note that texting will result in the quickest response time. Thank you for taking the time to review these instructions and entrusting us with your care. We are always here to help you have the best possible experience, and we look forward to seeing you and supporting you on your journey to better periodontal health.